So in order to have that orgasmic type of experience, you really have to have the tools to learn how to quiet your mind, to stop thinking, to allow your body to tell you what to do. You need your partner to know what to say, what not to say, where to touch, where not to touch, how to touch, to make sure that you're well hydrated. You need your partner to also have the skills to negotiate your care with your care provider so that they can support you throughout all of the stages of the labor. And that's how you come out in the end with feeling like you had this amazing, wonderful birth. So some women are like, yes. And then some women are kind of tired and like, need to recuperate after the birth of the baby, but it is definitely within us to have that type of experience. And as Stork and Cradle, that's what we are geared for. We're there that you can have this amazing experience. Some couples don't even know that the membranes could rupture without them actually going into quote-unquote labor, which is having true painful contractions. They believe that as soon as the water breaks, the baby is coming. And that's pretty much not the case in most cases. It can be many hours until the membranes rupture. So we spend a considerable amount of time talking about what to expect when the membranes rupture, what it's like, and do you need to panic? Do you go to the hospital? Do you go home? Some parents will say, I thought as soon as I get contractions, I go straight to the hospital. Well, you don't really have to go to the hospital right away. You can stay home and you can work through the contractions, because when you're home, that's when you have the freedom to do whatever you want at home. And so then the concern will be, what if I leave too late? You know, how will I know everything is okay? So we spend some time talking about that. What's normal, what's not normal? What are the signs that will tell you you should go to the hospital? And it's not just how often the contractions are coming or how far apart they are. There are more variables to that. Newborn babies are very tense usually. Their arms are like this. And so they try to pull the shirt over the arm and they kind of get stuck here at the wrist. So one of the techniques that I teach them is, as women, sometimes we know we have to bunch up our pantyhose or pull them all the way up the leg. And I teach them to do that with a long sleeve shirt. To bunch up the long sleeve shirt, put your hand through the t-shirt, grab the fist, and then pull the t-shirt all the way up the arm. So that's a big, simple trick to dressing these newborn babies.